Good afternoon. My name is Eric Welch. I'm a public health student at the University of North Carolina at Greensboro, and today we'll be talking about irritable bowel syndrome, or IBS. There are many different definitions for IBS, but the one we'll be using is a group of symptoms that cause chronic or intermittent abdominal pain with changes in stool frequency or consistency, and it usually includes diarrhea or constipation. The book also calls it spastic colon. I've listed several other things that it's been previously called before. There are 4 subtypes, which include IBS-C, which is IBS with constipation, hard or lumpy stools at least 25% of the time, and loose or watery stools less than 25% of the time. IBS-D, which is IBS with diarrhea, is loose or watery stools at least 25% of the time, and hard or lumpy stools less than 25% of the time. There's also IBS-M, which is mixed IBS. This includes hard or lumpy stools at least 25% of the time, and loose or watery stools at least 25% of the time. There's also IBS-U, which is unsubtyped IBS. This includes hard or lumpy stools less than 25% of the time and loose and watery stools less than 25%. There are several causes of IBS. First, there's colonic dysmotility. A patient seems to have a colon that is more sensitive and reactive than usual, so it responds by producing more diarrhea or constipation than usual. There's also visceral hypersensitivity, which is an increased sensitivity of the intestinal nerves. And then there's brain-gut dysfunction. This is a stimulation of the bowel which can affect areas in the brain producing emotional distress. Triggers include meals, reproductive hormones in females, emotional distress, and also abuse of laxatives. Symptoms include crampy abdominal pain, constipation and/or diarrhea, and also abdominal bloating. This illustration shows the severity of patients who have IBS. 70% of the patients have mild cases of IBS, 25 moderate, and 5% severe, with most of the people in the mild range not even going to a doctor. IBS affects 3 to 20% of the adult population, with most studies ranging in the 10 to 15% range. It affects twice as many women as men, and is most often found in people under the age of 45. This graph shows the prevalence in the U.S. of IBS compared to other chronic diseases. Ways to diagnose IBS include medical history, Rome criteria, and what Rome criteria is a standardized set of symptom-based criteria for IBS, physical examination, laboratory tests, stool samples, x-rays, and colonoscopy. Ways to treat IBS would include a good diet, medicines to help with some of the symptoms of IBS, taking a good probiotic, and also there are psychological treatments. Although this was a short presentation of IBS, I hope I covered all the basics. I appreciate your time and thank you.